Hello everyone, here I'm back with another video lecture, and today we're going to discuss the biomechanic case scenario number 1. Basically, in this case scenario, we're going to discuss a basic case that you have to see in a daily life. With that, we can discuss a very major special test that you can use basically in a daily life to diagnose this patient. Okay, starting from the very first, a 37-year-old male patient came in OPD with a complaint of pain in wrist region from 6 months, but now it increases its intensity. He is a typewriter for last 10 years. After the assessment, you see he has abnormal sensation like tingling and numbness on hand and atrophy of thenar muscles, and numbness and pain in 3.5 fingers, including thumb. What is the diagnosis of this patient? Basically, if you can notice from the very first that this patient is 37-year-old, the second main point is pain in the wrist region from last 6 months, but now it increases its intensity. Okay. The third main point is basically typewriter. The patient is a typewriter for last 10 years. It's probably from the age of 27 that he started working as a typewriter. So after you can see this major point, you can assume many of the differential diagnosis. Okay, after the assessment, you see he has abnormal sensation like tingling and numbness on hand. Basically, patient has tingling and numbness, so basically there must be any of the nerve involvement in this. Okay, then the next is atrophy of the thenar muscles. Thenar muscles are the muscles that are basically make the thenar eminence on the region that is closer to the thumb. Okay, so basically thenar is the region that is basically the protruded region in the or eminence of the hand that is basically present in the on the side of the thumb. Okay, numbness and pain in 3.5 fingers including thumb. Okay, now you can see basically the numbness. So numbness is also we have discussed that numbness and tingling is present, but they have discussed here that 3.5 fingers including thumb. So that means they have included the thumb, the index finger and the middle finger, and last one is the ring finger, half of the ring finger. Okay, so you can say basically you can assume from here the nerve, which nerve is basically the culprit here, is that supplies the 3.5 fingers of the hand, and that nerve is the major cause of this diagnosis, major cause of this disease. Okay, so the nerve that supplies the hand and 3.5 fingers, that is basically the median nerve. Okay, so from here you can basically assume that the diagnosis of this patient is carpal tunnel syndrome. Okay, so you can now, before going telling you have to, before seeing that carpal tunnel is the basically region that is present in front of the wrist region. Okay, you can say the flexor retinaculum has covered the region, and the tunnel has many of the tendons passing from here, arteries, veins, and from here the major that nerve passes from here is the median nerve, and median nerve is the cause of the carpal tunnel syndrome. Basically because of an inflammation, any of the things that you can say, blood accumulation, inflammation, swelling, any trauma, overuse, any of the thing that causes a median nerve to compress in the carpal tunnel region is basically the carpal tunnel syndrome. Okay, so from to basically finalize, or you can say to concluded this diagnosis, you can first have to assess the uh, patient, and to finalize this diagnosis we have used one special test that is called as Fallon's test. So this is the phalanx test. Basically, phalanx test is both posterior sides of the hands are connected to each other in this position, and you can say in this position, or you can say in a slight flexion position. We can basically ask patient to stay in this position for about 1 minute, and if patient gives or if patient complains of aggravating of the symptoms, you can say increasing in the symptoms, that is basically the positive phalanx test, and that is basically concluded the whole diagnosis of the carpal tunnel syndrome. That is the major test that we can use, because this can show if the median nervus compresses in this region, the pressure increases in the carpal tunnel region, that causes the aggravation of the symptoms. So area of numbness and tingling is basically the symptoms of numbness and tingling is increases in 3.5 fingers. Okay, you can say, hey, see here the median nerve is supplying the 3.5 fingers, and this is the carpal tunnel region where the median nerve is passes from here. Okay, so thanks for watching. If you have any query, you can ask in the comment section.